Hello, this is naturopathic Dr. Chris Habib. I have the pleasure of sitting here with naturopathic Dr. Christine Matheson. Dr. Matheson is a naturopathic doctor who's been in practice for 13 years. She is an expert in pelvic and abdominal health. She even created the Belly Be Well program. Dr. Matheson, thanks for chatting with me today.
My pleasure.
So I know that your practice is very broad. You see a wide range of conditions in the family, but you went about creating this specific program called Belly Be Well. Can you tell our viewers a bit about that?
Absolutely. I'm very passionate about it, so I'm happy to talk about it. Early on in my career, as a naturopathic doctor, I knew I had a range of therapies that could be very helpful for people dealing with abdominal and pelvic concerns. But it was brought to my attention that there is a technique called Arvigo techniques of Maya abdominal therapy. And the healers in Belize, a particular group of healers, had this wonderful technique that a woman named Dr. Rosita Arvigo went to study. And she is the reason that this technique is now reaching in many places in the world. And so I'm honored to be one of the few practitioners in Toronto offering it, and one of the few naturopathic doctors offering it. And essentially it is an external massage technique applied to the abdomen and the lower back and the pelvis. And it's also an opportunity for me to teach patients how to massage their own abdomen. And the whole idea behind it is that if we can improve the flow of circulation, lymphatic flow, decrease any congestion where our vital organs are, and for women particularly around the uterus, we can enhance our health greatly and the functionality of our organs. So for many people who receive it, it improves digestion, it improves urinary flow, decreases any congestion hormonally in that area. So for many women, it improves their menstrual health. It can very much is known to enhance fertility, which is one of the wonderful side benefits. And so for many people, it has been beneficial. So what I did is I didn't want to separate that from the value of all the naturopathic therapies. So I safely combine and intertwine all of my naturopathic therapies that could be applicable to a patient, and add doing the Maya abdominal massage and teaching the patient to massage themselves. So for me, calling it the Belly Be Well was a way to make it accessible, because many people who come to us as naturopathic doctors start by pointing to their abdomen and to their belly and start by saying, I have some issues in this area. So if we can make that area well, whatever the reason is that you're feeling unwell in that area, this is an opportunity to do that through various therapies, and for the patient to feel part of that by learning how to massage their own abdomen and receiving the treatments, which are highly beneficial as well.
Wow, so you've integrated both naturopathic medicine and the Maya abdominal massage into one almost super treatment.
Yeah. So the appointments are a little bit longer, which allows for a chance to review the naturopathic protocol that would be administered. So typically at a second visit, I've put together a treatment plan, whether my patient is simply a naturopathic patient or a Belly Be Well patient. And I've put together all my research for that patient. And then I, in a Belly Be Well appointment, have an opportunity to give them a massage treatment and review how their self-massage is working for them. And then every visit we check in and see how their naturopathic therapies are going, whether they've made changes to their diet, or we're using herbs or homeopathics or Chinese medicine. And then we also do a massage every treatment. So it's just a slightly longer appointment, but patients really enjoy it because it engages them in their self-healing. It's very relaxing, and it's actually the best compliment is that they often send me a message the next day saying how well they're feeling, how things are flowing better for them.
Oh, that's wonderful.
Yeah.
So then I'm curious, what types of conditions do people have when they come see you, in particular for the Belly Be Well program?
So typically, I guess there is quite a range, but first and foremost, it's largely women that I see, and I've focused on women specifically for my Belly Be Well program. And so in that case, we're working with uterine health. So it may be that they have hormonal health issues, difficult, painful menses, PMS, a desire to conceive, or preparing to conceive. It could be that they specifically know something about their uterus. It may be leaning or prolapse to one side, and they want to correct that or create better alignment. It may be that their bladder is the issue, so they may have some difficulties with urination and they want to create less congestion in that area. Digestion is probably one of the most common reasons, and it could be overlapping with those things that I've already mentioned. So constipation or irritable bowel syndrome, and making sure that we're encouraging healthy digestion and flow. And other reasons could be simply that, they're at a point that they often have heard about Mayan abdominal massage in terms of its benefit for fertility. Mm-hmm. So that can be an adjunct to if they're receiving fertility treatment, or simply if they want to try to conceive naturally and add this as a therapy.
Perfect. Wow. So definitely a wide breadth of conditions.
Yes, which is exciting. And again, it engages the patient in their self-healing because they learn how to massage themselves.
Excellent.
And it's wonderful for that reason too, in my view.
Great. Well, thank you, Dr. Matheson. So I'm just going to read off your contact information. Dr. Matheson can be found in Midtown Toronto at Mahia Forest Hill. The website is mahiaforesthill.com. And the phone number is 416-792-4400. Thanks again.
Thank you.